Our flight's about to board in, I think, 10 minutes, so we'll be there soon. We got in around 2:30 a.m. and up early for the meeting this morning, which would be way more difficult if we weren't in such a beautiful location.
So on behalf of my colleagues and myself from Kenya, we welcome you to the job.
I hope you're all ready for the 2019 Joint Action Plan for the Health Systems Advocacy Partnership.
Now the context teams are sitting together to go over the outcomes of the past year, to see if they've captured everything they've done or if there's things they have to rephrase and things like that.
We're currently talking about sustainability for the Health Systems Advocacy Partners. They're looking at making their programs more sustainable for the future so that outcomes can continue over time.
Most parts of the conference of this workshop will be discussing about sustainability, isn't it?
What was really nice today was a cool opening with quite a lot of energy, good speeches from people from Kenya, the Ministry of Health, from Frank van der Looy from the Ministry of Foreign Affairs, to really guide us for the next year on what to do. What we still need to work on is how to sustain all those outcomes, and yeah, the end evaluation might help us. I think that summarizes today.
Morning. Yes, thanks. Day 2 of the Joint Annual Planning Meeting 2019. I forgot my program in the conference room, so I can't remember what we're talking about today, but I know we're talking about gender, and I imagine we'll probably do some more planning for the future. So let's get started.
So I'm happy to join the session midway. Already you began to identify that as you're getting to these communities, you must look at both the roles and responsibilities of men and women, boys and girls, especially at the decision-making level.
Currently having a panel presentation on day 2 of our joint annual planning meeting, where we're talking about health systems strengthening impacts on sexual and reproductive health.
Community health workers need the skills that they can competently provide these services.
We need to find a new way of doing things. We need to do things differently.
At the moment, we are just discussing potential plans for next year, looking at the context, the environment, and the policy environment, but also in our group, we're just discussing the political shifts in Tanzania regarding the shrinking space for civil society and how the HSA partnership can impact and kind of like expand that. What are we going to do together to achieve the change that we want in improving SRHR?
Today was the second day of the Joint Action Planning meeting for the HSA Partnership, where we have about 60 participants from 6 countries. And today we were looking mainly on issues around gender and gender mainstreaming, and we also got to see practical examples of how youth and communities are engaged and integrated within our SRH programs. We also got an opportunity to watch a documentary that validated the research that we have been doing over the last 3 years on availability, affordability of SRH commodities, case studies of 2 counties in Kenya, Vihiga and Kakamega County, and we are hopeful as we go into the last day we'll be able to get good outcomes that will inform our 2020 work plan.
We're at day 3 of the Joint Annual Planning Conference. Today we're really looking into the future, seeing what 2020 holds for us and a little bit more planning.
Good morning.
Morning.
So, what do we want to know?
One of the biggest challenges we face in health in Africa is financing for health in general.
The big issue is the disconnect between the global commitments that national governments are signed to and their domestication of those issues.
Services need to be youth-driven because we are advocating for youth-friendly services.
Social accountability for UHC is to have sustainable models like the Youth Parliament, the civil society network, coming up with manuals and also coming up with a mechanism of public participation that everybody is involved.
Thank you very much. That was sustainability.
And well, I really enjoyed having that last moment together, and hope we can still have the different moments in the country and really get those outcomes we want in 2020.
The most difficult part of project implementation is project closure. But on that tone, my call for attention to all of us is to have a very strategic closure of the project so that we can see it as the show when we close together. Thank you. One, two, three.